1. Which principle of adult learning emphasizes the importance of learners connecting new information to prior experiences? A. Operant conditioning. E. Andragogy. C. Behaviorism. D. Constructivism. 2. When developing simulation objectives, which component should be prioritized to align with curriculum goals? A. Learner satisfaction. B. Institutional branding. C. Measurable learning outcomes. D. Technology availability. 3. In simulation debriefing, the primary purpose is to A. Correct learner mistakes immediately. B. Reinforce factual recall. C. Promote reflective learning. D. Test memory retention. 4. Which evaluation method best measures competency in psychomotor skills during simulation? A. Self-assessment questionnaire. E. Objective, structured checklist. C. Multiple choice exam. D. Peer review. 5. Which instructional design model is most widely used in healthcare simulation? A. ADDIE. B. Kirkpatrick. C. Gagne's 9 events. D. Maslow's hierarchy. 6. Which factor best reflects alignment between simulation activities and regulatory compliance? A. Use of innovative technologies. B. Integration with accreditation standards. C. Learner preference surveys. D. Budget allocation. 7. The primary role of a mentor in simulation education is to A. Impose rigid teaching methods. B. Facilitate learner growth and autonomy. C. Deliver lectures exclusively. D. Assess knowledge only. 8. Which communication strategy fosters the most effective feedback in simulation-based learning? A. Closed-ended questioning. A. Directive instruction. C. Advocacy inquiry. D. Memorization drills. 9. In curriculum development for healthcare simulation, which step ensures alignment with stakeholder expectations? A. Randomized learner selection. E. Needs assessment. C. Pre-post test analysis. D. Peer-reviewed publication. 10. Which principle of formative evaluation is crucial for ongoing improvement of simulation programs? A. Final exam results. B. Continuous feedback. C. Instructor-centered grading. D. Annual accreditation renewal. 11. Which adult learning theory emphasizes problem-centered learning rather than content-centered? A. Humanism. B. Andragogy. C. Behaviorism. D. Cognitivism. 12. Which Kirkpatrick level evaluates the effect of training on organizational outcomes? A. Reaction. B. Learning. C. Behavior. D. Results. 13. When addressing learner anxiety during simulation, the educator should A. Ignore emotional responses. B. Provide psychological safety. C. Reduce scenario fidelity. D. Eliminate performance feedback. 14. Which debriefing model is most frequently used in healthcare simulation? A. Kolb's cycle. B. Plus delta. C. Gibbs' reflective cycle. D. Gather, analyze, summarize. 15. Which assessment method provides the highest reliability for simulation-based evaluations? A. Open-ended reflections. B. Standardized rubrics. C. D. Learner self-assessment. 16. In regulatory compliance, simulation programs must demonstrate PAW. A. Learner popularity of scenarios. B. Evidence of standardized assessments. C. Faculty preference alignment. D. Institutional prestige. 17. Which mentoring approach encourages reflective practice in novice educators? A. Direct instruction. B. Socratic questioning. C. Silent observation. D. Scripted guidance. 18. In adult learning, the role of intrinsic motivation is considered. A. Irrelevant to performance. B. Central to sustained learning. C. Secondary to external rewards. D. Unnecessary for professionals. 19. Which element should be included first when writing learning objectives? A. Assessment criteria. B. Action verb. C. Simulation equipment. D. Institutional goals. 20. Which best practice ensures confidentiality in simulation-based assessment? A. Public posting of scores. B. Blinded evaluations. C. Group discussions of errors. D. Peer grading. 21. The most effective feedback in simulation is A. Immediate, specific, and actionable. B. Delayed until final exam. C. Generalized and vague. D. Focused only on positive aspects. 22. When aligning simulation with accreditation standards, the educator must A. Review curricular frameworks. B. Prioritize student requests. C. Limit evaluation to summative tests. D. Adopt outdated checklists. 23. Which evaluation strategy measures long-term retention of simulation learning? A. Immediate post-test. E. Delayed follow-up assessments. C. In-class quizzes. D. Simulation rehearsal. 24. Which role does a simulation educator serve when guiding learners through critical reflection? E. Evaluator. E. Facilitator. C. Observer. D. Technologist. 25. In program evaluation, the CIPP model emphasizes A. Context, input, process, product. B. Content, integration, planning, purpose. C. Curriculum, instruction, practice, performance. D. Communication, innovation, participation, policy. 26. When creating scenarios, fidelity refers to A. Accuracy of learner responses. B. Realism of the simulation. C. Faculty experience level. D. Institutional investment. 27. Which mentoring technique encourages professional identity development? A. Role modeling. E. Passive observation. C. Content memorization. D. Directive lecturing. 28. Which adult learning principle highlights the role of self-directedness? A. Cognitivism. B. Andragogy. C. Behaviorism. D. Experientialism. 29. Which communication barrier most often impedes debriefing effectiveness? A. Over-reliance on advocacy. E. Use of open-ended questions. C. Psychological safety. E. Hierarchical dominance. 30. Which element of simulation supports transfer of learning to clinical practice? A. Random case selection. B. Realistic contextual scenarios. C. Learner social activities. D. Budget expansion. 31. What is the primary purpose of formative assessments in simulation? A. Certify competence. B. Support learner improvement. C. Rank students. D. Ensure compliance. 32. Which Kirkpatrick level is directly assessed by post-simulation surveys on learner confidence? A. Reaction. B. Learning. C. D. Results. 33. Which type of objective specifies observable and measurable learner behavior? A. General objective. B. Terminal objective. C. Educational philosophy. D. Instructional material. 34. Which factor contributes most to interprofessional education success in simulation? A. Competition between groups. E. Collaborative teamwork. C. Faculty dominance. D. Time restrictions. 35. Which strategy is best for mentoring faculty new to debriefing? A. Gradual role modeling. B. Assigning advanced simulations immediately. C. Eliminating peer feedback. D. Excluding them from sessions. 36. Which evaluation type focuses on program improvement during implementation? A. Summative. B. Formative. C. Norm referenced. D. Criterion referenced. 37. Which element of adult learning is emphasized when learners set their own goals? A. Self-concept. B. Behaviorism. C. Reinforcement. D. Hierarchy of needs. 38. Which type of fidelity involves accurate replication of patient physiology? A. Conceptual fidelity. B. Psychological fidelity. C. Physical fidelity. D. Emotional fidelity.